This is Home Care Happy Hour, the only podcast that keeps you up to date on what's happening in the world of home care and gives you the celebrity tea you didn't know you needed.
Well, hey everyone, and welcome to Home Care Happy Hour. Hello, Kate. How are you doing?
Hello, Bailey. Good. It's been a minute since we've gotten to film a podcast, huh?
I know. We're covering the Indiana moratorium.
Dun, dun, dun.
Are you impressed I said that word correct?
You did. Yeah. You said it very confidently. Yeah. I know it's been a bit of a tongue twister in the past.
I know. Moratorium. It's a hard one, guys. I know you guys are struggling with it at home too. So, yeah, we're covering the Indiana moratorium a little later today and everything you Indiana agency homeowners need to be aware of for the government crackdown, basically. Here we go. Government crackdown. Yes.
Exactly. Yeah.
Yeah. So if you own or operate a home health agency in Indiana, this episode is for you. And honestly, depending on whether you are in the Medicare enrollment process right now, this might be one of the most important 30 minutes you spend this month. So I think you guys are going to be very impressed. We are going to go over celebrity updates first. So if you guys would like to listen to celebrity updates, even if you're not an Indiana agency, please stay tuned. We've got some fun things to go over today. There's lots happening. All right. With that being said, let's get into it.
Let's do it.
So first up, Kate, I have a story about Simon Cowell's fiance, Lauren Silverman, and details on getting pregnant during their affair.
Okay, you gotta tell me. I have questions already. When Bailey said this was the topic for today, this was one of our celebrity updates. I said, okay, whose affair? Is she pregnant as a result of her own affair? Did she and Simon Cowell have an affair that resulted in a pregnancy? Was the pregnancy coincidental? And he had an affair and was stepping out while she was pregnant. I have questions. Bailey, you got to fill me in.
So Lauren Silverman is pulling back the curtain on their relationship. More than a decade after the entrepreneur's affair with the now fiance Simon Cowell, she reflected on the complicated emotions surrounding her pregnancy with her 12-year-old son, Eric Cowell, while still married to Andrew Silverman. I don't know who
she
is.
Stepped out with Simon
It was
Cowell
the end of my marriage, obviously, Silverman. Also mom to Adam Silverman, 19, with her ex, said on June 16th. So she has a 12-year-old and a 19-year-old. So at the time, she had a 7-year-old with this guy. Yeah, so I didn't know that Simon Cowell had an affair with this girl. I knew he had a girlfriend that he had been dating for like 10 years and wouldn't marry. Like, I knew that was a thing.
Oh.
She did say, I felt like I was walking around with a scarlet letter everywhere I went because New York, even though it's a big city, it's really small, especially where I lived, the Upper East Side. Oh, good for you, Lauren. Okay. It was just the way that people would look at me. I was on the cover of every magazine. Man, we missed this. Wow. I missed this update.
What was I doing 12 years ago? I don't know. I was probably very self-absorbed. That's like teenage Kate, 12 years ago. Yeah. I was worried about passing classes. But I would imagine you feel like a scarlet letter. Listen, I was pregnant during grad school, and the way that my grad school worked is you're in classes with undergrads in the same buildings and whatever. You just have to do extra projects and TA and stuff like that. And I was married. I'm still married, but married, but had a big old belly, and I'm there with all these undergrad kids. And I felt like I had a scarlet letter walking around, and I was like, I promise I'm happily married with a mortgage in a stable, healthy relationship. And I still feel like I was wearing a scarlet letter.
So let's jump into some fun news now that we covered what Simon Cowell was doing 10 years ago. That was a little scandalous. He's AGT judge. If you are, remember American Idol back in the day, all of that. Yeah.
Yes.
Okay. So Taylor Swift's wedding stage is currently being built in Madison Square Garden. TMZ reported a massive stage. TMZ reported a massive stage is being constructed under lock and key at Rocklets in Pennsylvania, in the same facility where major concert tours are built. And NYC's mayor even confirmed the city is expecting the event.
Yeah, listen, you knew she's going to have a summer wedding. I mean, beautiful weather. People get married in June all the time. I believe it. I could see it. She seems like a summer wedding kind of girl. They seem like a summer wedding couple, I guess I should say.
Yeah. So did you see the airplane video that came out where she was like feeding him food? Like he was a baby.
Oh, not like feeding him on an airplane. She's like open wide.
Yes. And it's causing a lot of controversy.
Baby.
People are like, is this real? Is it not? Like, no one does this. This is weird. It's a little staged. I don't know. I need to see a marriage document, Taylor. That's where I'm at.
We should make bets on whether or not they get married in public, but like are not legally married.
Man who stole Beyonce's unreleased music was sentenced to 2 years. Kelvin Evans, 40 years old, broke into a rental Jeep Wrangler. Jeep Wagoneer. Sorry, that's the fancy Jeep.
Oh.
Belonging to one of Beyonce's choreographers during her Now Cowboys tour stop in Atlanta, July 2025, stealing unreleased music and personal items. Not all the items were recovered, but fans celebrated the outcome, viewing the sentence as necessary protection.
Do you think he broke in just because it looked like a nice car and he wanted to break in for other things? Or do you think he broke in for Beyonce's music?
I like to think he was like a Beyonce lover and he was like, I got to get my hands on this tape. And he like found this person's car and he broke in and he was like, I will be the first to listen to her album.
I do like the idea that he's a Beyonce fan better. You're absolutely right, Bailey.
Yeah.
Where he's like, I have to get my hands on her stuff.
Yes. All right. So let's jump into the Indiana moratorium and the updates you guys need to know for home care. All right, so here's what's happening. Indiana already had a major compliance deadline on the books. Every HCP-enrolled home health agency had to hold active Medicare enrollment by July 1st, 2026. We've talked a lot about that. You guys know about that already. A lot of agencies were working toward that. Some were ahead of it, some were behind it, cutting it a little close. And then on May 13th of this year, CMS dropped something no one saw coming, a nationwide freeze on all Medicare enrollments effective immediately. Kate, I'll kind of let you take over from there.
Yeah, big deal. So CMS said, okay, if you're a home health agency or a hospice agency, done, kaput. You can no longer enroll in the Medicare program. In fact, if your application is pending, it's getting nixed. It's not making it. So that's not a huge deal necessarily for all Medicaid programs, but some states like Indiana recently require that in order to be a Medicaid certified home health agency or hospice agency, you have to get your Medicare enrollment done. So with the CMS Medicare freeze, it really negatively impacted these Indiana home health agencies with getting their Medicare certification, which is part of how they stay current and in good standing with IHCP, which is the Medicaid program. So it's bad news all around for those providers who had not gotten the chance to get their Medicare enrollment done yet.
Yeah. So the moratorium does not affect agencies that are already enrolled in Medicare. Correct. If you already have a Medicare provider number,
lucky you.
Yes, you can keep operating, keep billing, and keep updating your enrollment information, phone numbers, addresses, practice details without any issue. But there's a wrinkle that a lot of people missed. The MAC guidance came out in the weeks following the announcements, clarified that the freeze also applies to existing providers trying to add a new branch location. So even if you're already enrolled and you were planning to open up a new branch and hadn't gotten that application in before May 13th, that expansion is frozen too. So that's unfortunate.
Yeah. Also selling, change in majority ownership, I believe is how that's phrased, but like selling it, if you were planning on selling your agency, that's also been locked down.
So Kate, do you have any theories about why CMS did this? We'll do Kate's theory and then why they said they're doing it.
What they actually said they did. Yeah. Listen, so CMS uncovered a ton of fraud for DME providers, right? Durable medical equipment. Think like giving people wheelchairs and walkers and that kind of thing. But they also found a bunch of fraud for home health and home care and hospice agencies. Now, unfortunately, people who are going out and like rendering services out in the community, they don't have as much oversight. I mean, they do have oversight, but not in the way that like a physical location does. You know what I mean? Where like you have people coming in and out and you have cameras and you like have all of that. And so there were just some bad actors out there that were billing like absolutely fraudulently. Like they were going on vacation and still saying, no, I was there. I rendered services to Bailey. Like bad, right? And those were actually kind of named in CMS's new stuff. So I think CMS shut it down. They put the kibosh on it just to be like,
I think,
hey, look, we have to get this under control. Like, we have to like figure something
I think
out.
part of the reason they did this, part of it was fraud. I think the other half
Mhm.
is they overspent by $2 billion.
Oh, a crazy amount of money.
They
Crazy
were
amount of
in the
money.
hole, and
Yeah.
I think they're taking advantage of this opportunity to pull back a little bit.
Yep. Yep.
Yeah, granted.
Definitely.
Yeah. So the numbers they cited were striking. Just before the moratorium, CMS suspended payments involving 773 hospices, 23 home health agencies in the Los Angeles area, and representing $70 million in suspended funds. So their position is essentially this. So that was our personal opinion of what we think is going on. And this is what they're stating. They've spent years trying to recover improper payments after the fact, and the deterrent effect hasn't been very sufficient. So now they're moving upstream. They want to stop fraud before it starts, not chase it down afterwards. So they're pausing everything in the meantime.
Which, like, I kind of get as a concept. It's like, you got to get your house in order. Listen, Bailey, you know I call Medicaid offices all day long. I know you talked to a Medicaid office in a particular state today. And how easy was it to get somebody on the phone?
It took me 15 minutes to get through the menu because I was like, 0. And they were like, no, incorrect.
Yep.
0, press 1,
Yep.
press 1. I got transferred 3 to 4 different times.
Yeah.
I did not receive the answer I was looking for.
That's right.
And I would say the sassiest lady I came across, I was like, hey, how you doing today? She said, fine. Period.
Yep. Yep.
Oh.
Like,
all right.
It happens in these Medicaid offices and Medicaid departments, and expecting them to be watchdogs, to be all up in somebody's business, to like monitor for fraud, I think is a bit of a stretch. I think that sometimes like those Medicaid agencies maybe aren't, I don't want to say they're not run well, but they don't have that sense of urgency about them.
Yeah.
And I would imagine that trickles down into...
You're being way too nice. When have you ever seen a Medicaid office have urgency to answer the phone, get back to you, answer your question?
It's so true.
If you guys know of anything, you can comment below, like a good experience you've had. Even getting people who need care off the wait list. These people are waiting 6 months, 7 months, like
forever. I was calling Medicaid office today, Bailey, and you know what they told me? I'm running around like a dog chasing my tail, and they tell me, oh, some Medicaid departments, I don't know if you know this, someone just told me they don't have phone numbers. I said, excuse me, ma'am? She said, that's what one of my teammates just said, is that some of these departments actually don't have phone numbers to give you. I said, what about an email address? She said, they don't have that either. I'm like, who is in this office then? They have no way to contact them?
Yeah, they just don't want to be contacted. And that
they don't
not
want to be
having
contacted.
they don't want to be contacted, and not having phone number is a pretty effective way of not getting contacted.
It is. And you know, I dig into it. Like, I try to get in their business, and I couldn't find an email address or phone number.
They want to know. They want to hear the timeshare story. You don't have to name names of which entity did this. Okay. But our viewers, they want to hear. They want to hear about this timeshare thing that happened to you. This has to do with the Medicaid office. We're not just jumping off into timeshare talk, by the way.
No. Yeah. This is like actually legitimate. Okay. So like I mentioned, Bailey and I call a lot of Medicaid offices to get information for y'all, right? Recently, I called the Medicaid office to get some more information on things, on moratoriums, in fact. I'm like, I'm trying to get a hold of this thing, whatever. It's like, we don't have it. Send an email. I said, okay, yes, here's an email. This is what I'm trying to do. Can I get some information on this? Whatever. I get a response with no name signed. It's just a response that says, oh, listen, you have to call this number. They have all the information you need. Whatever. I was like, oh, perfect. Yes, I'll call. It's so hard to get a phone number where it's the right one. I'll give it a shot. I did not use my company phone number. I should have. I used my regular phone. This is also a rookie mistake. I used my regular phone to call. And Bailey, it was a timeshare organization. No. And so because I called a timeshare organization, I have everybody and their mother trying to call me, selling me on, oh, come to this place in Georgia, come to this place in Florida. And I keep getting these calls.
So now you're being sold to nonstop because the Medicaid office sent you a timeshare number to get you to stop 100%. Calling them.
Yes.
Yeah.
Yes.
So back to the Indiana moratorium. Now let's talk about what makes Indiana different than any other state in the story. Indiana had already had something on the books completely separate from the CMS moratorium under the IHCP bulletin. It was Indiana 595. If you're looking for that, I'm not going to read out the whole bulletin number, but it ends in 595. And it was issued last June. Indiana foreshadows when they know something's coming that's bad, they'll send out bulletins before it happens. I've noticed this in Indiana. Every home health agency enrolled in Indiana Medicaid as provider type number 5 is also required to hold an active Medicare enrollment by July 1st, 2026. And that was in the bulletin last year. That requirement wasn't new when the moratorium hit. Agents have known about it for almost a year. The intent was straightforward. Indiana wants its Medicaid-enrolled home health agencies to meet the same federal standards required for Medicare participation. It elevates the bar across the board. But then May 13th happened. Wait for it. And Indiana is saying you must have Medicare enrollment by July 1st. CMS is saying if you didn't apply before May 13th, you cannot get Medicare enrollment right now. For agencies that had initiated their Medicare enrollment or accreditation process before April 1st, 2026. So if you're watching your bulletins and you applied when you were supposed to, you came to our webinar, we told you about this, you did it immediately. Indiana law provides a good grace provision. Those agencies can continue receiving Medicaid reimbursement while their application is still pending. That's a lifeline for providers who moved early, even if their paperwork hasn't fully cleared yet. So the problem comes about with agencies that have not submitted their paperwork or enrollment application are now kind of just out of luck. It is recommended that these agencies reach out to IHCP, CMS, and legal counsel to determine the best options going forward. But given our stories of the phone lines, we would like to wish you good luck.
Yes.
Yeah,
Well, and something we might talk about here in a minute is kind of some implications for home care agencies. All the stuff that we're talking about right now, this is all home health. Okay, these are home health agencies. That provider type 5, that's a home health agency.
Yeah, so if you're sitting there in the car and you're going, oh my gosh, am I provider type 5? Did I need to do all of this? Am I getting paused? Probably not, unless you're home health and you do not have your Medicare enrollment.
Yeah, exactly.
Okay, Kate, let's jump into what Indiana agencies need to do right now. We have a lovely little checklist that we're going to go through, read, and talk about with you.
Love it.
So, number 1, if you're already enrolled in Medicare and you have your provider number, you're clear. You cleared the highest hurdle. You're good. You're good to go. But do not assume you're done. Get information and confirmation that your Medicare enrollment is now active and that your effective date falls before July 1st, and then notify your IHCP enrollment contact and provide your Medicare provider number for their records. Don't assume that the information flows automatically between CMS and IHCP. Just go ahead and be squeaky wheel, email that in. And we like to say in Medicaid that if you didn't document it, it didn't happen. So
it didn't
document
happen.
it. Document it.
Yes.
Okay.
Send a follow-up email. Do what you need to do to make sure that you have it time-stamped that it was handled.
All right. Number 2, if you had an application pending with Palmetto GBA before May 13th, this is what you need to do.
That's the Medicare contractor, by the way. That's who that is.
Follow up directly and confirm your application is being processed under the pre-moratorium recipient date. So make sure they know that they can, you kind of have a loophole. Get that confirmation in writing, know where you stand in the queue, and what your expected timeline looks like.
Yes.
Yeah. If you initiated the Medicare enrollment or accreditation process before April 1st, but aren't fully enrolled yet, this is what you need to do. You may qualify for Indiana's grace provision to continue billing Medicaid while your application is pending. Document everything: dates, submission, confirmations, correspondence with the IHCP. The paper trail is your protection if your billing is ever questioned.
Right. And you do have, listen, if you're like pending Medicaid enrollment, all of that, you do have to be Medicare certified by next July. But that gives you a year and some change for that to finish, for the moratorium to hopefully wrap up, all of that kind of stuff. If it doesn't, that's going to be a different discussion.
For all Indiana agencies who are not home health and just home care, this is what you need to do. Not really a whole lot, but keep your eyes on the Federal Register for any moratorium extension announcement in November, and watch the IHCP portal for those bulletins as they get posted. just so you're up to date on all the news. We also watch those pretty vigilantly, and we email those out for you guys. So if you're just following Gio's content, if you're on our list for the Indiana newsletter, you're good to go. Don't super stress about following the news. We have a person that just follows Indiana news. Like that's her whole job.
And
so
can I give you just a little Kate best practice reading between the lines kind of tip here? Indiana has released some stuff saying they're going to crack down in particular on providers without an NPI. If you're a personal service agency in Indiana, you're not required to have an NPI, but you can get one. You get it at NPPES, but you can get an MPI, and you're going to get an MPI that's listed as an in-home supportive service agency. Okay. In-home supportive service. That's your magic phrase you're looking for. That's what you apply for an NPI with. You can do it. It is free. You just have to have some paperwork. But Indiana has said, hey, we're going to be taking a closer look in particular at people without an MPI. And it's not required if you're a home care agency. So my best practice tip, go ahead and take a look at it now.
And you guys know how Indiana foreshadows. So if they're coming out and they're saying, hey, you might want to get your NPI, it's just foreshadowing for something they're probably going to do later. That's just like this moratorium, they gave you a whole year. They were like, hey guys, get enrolled. And then they were like, and freeze. So they kind of warn you. Wink, wink. They'll like send out a bulletin. They'll be like, make sure you have this, everyone. So definitely get your NPI number if you guys do not already with what Kate told you. Where Kate told you to go. All right, you guys, that is a wrap. We're excited you guys were here. We had a lot of fun talking about the celebrity updates, Simon Cowell, Taylor Swift, the wedding,
fun stuff today.
And of course the Indiana moratorium, which hopefully your big takeaway is if you're a home care agency, you don't need to panic. But if you
take a breather,
are a home health agency, there's some things you needed to apply for. So we're excited you guys came out. Thanks for coming. And we'll talk to you later. Sound good?
Bye, guys.
Bye for now.